Hi, my name is Dr. Kevin Mitchell. I'm a full-time faculty member and program director in the MHA or Masters in Health Administration program. Well, I think both programs are for a certain type of student. So the undergraduate program, I think, is more for students that want to enter into a career in health administration at the management level. I think our degree focuses very specifically on our coursework. So I would say a degree in business administration with a concentration may focus on 6 or 7 courses that focus on health administration. But our undergrad degree focuses maybe 12, 15, 16 courses on health administration, which will prepare them differently. So the plan of study differs depending on which route the student wants to go. We have a 4-year route where students will just continue and take the required courses without a co-op. Then we have a 4+1 year where they actually take the electives, the required courses, and then they take their co-op experience in their 3rd year. And then we have 5+3 where students can finish their degree in 5 years and have a co-op experience, 3 co-op experiences in their sophomore, junior, and senior year. We just launched a new accelerated program where students can complete their undergraduate degree and their graduate degree in 5 years. So they would actually apply for the program at the end of their sophomore year, and they would be admitted to the program that upcoming junior year. So it gives them the flexibility to go to school for their undergrad, and if they already have the goal to complete their master's, they can do that in 5 years also. Wow, the career paths in health administration vary quite a bit. Of course, students come to the program with diverse experiences. They have a lot of different thoughts as to which way they want to go. But once they get into the program, we try to clarify those routes for them. There are a lot of different jobs. We have people working in the pharmaceutical industries, account managers. We have a VP of sales in insurance companies. We have many people that work for Penn and CHOP. They hold various types of positions, project management positions. They'll use their degrees, of course, to either manage people or manage projects. But with the health policy, we see them working at different governmental agencies, nonprofits, for-profit agencies, and they are responsible for shaping policy to make sure patients get treated well. So, different ways students can go, but we try to help clarify some of their interests and point them in the right direction. So one cool job was I was an assistant health administrator and a health administrator in a maximum security prison, and that was very, very interesting. Of course, there's a lot of disparities within the inmate population in regards to making sure that they get the proper amount of care, the right type of care, but there's a lot of challenges in regards to getting them that care. Of course, it's a very interesting environment, but we strive hard to make sure that they get care also. Well, I think a lot of questions that I would like them to know, or what they would ask me, is about the career paths. Sometimes students have questions about salary ranges, which, a lot of students want to know what it's like to work actually as a health administrator, and being able to describe that to them, putting them in that position on a day-to-day basis can really kind of help clarify where they want to go. A lot of students sometimes want to follow more of a clinical route, and some want to follow kind of a non-clinical route because they have an idea of what it's like to being exposed to patients and whether or not they're going to have to interact with patients at what level. So trying to help them clarify that. I think it's also important that some of the students, of course, they want to know what is their job growth, and their job growth is continued to expected to grow for a quite long time. I think it's projected until like 2030 or whatever the case may be, because of just a growing population, senior population, and just healthcare in general is just continuing to grow. So there is a lot of opportunity, but just helping them maneuver and target where they want to work is kind of our goal, to make sure we fit those competencies that they're learning in our program to where they want to go in their careers. Well, we have the new health sciences building. New health sciences building, we have classrooms that are equipped with state-of-the-art technology. We have a simulation lab where students can go and actually interact, do live simulations, and just kind of put themselves in the role of health administrators to see what it's really like. They receive feedback and they just kind of learn what it's like to be a health administrator. One of our faculty member, Dr. Fred DiCostanzo, he's responsible for the simulation lab, and because he actually is a nurse and he's been a nursing manager, he's put together coursework where students can come in, function in that nursing manager role, and really help them see what it's like to have employees and what it's like to work with employees, give them feedback, give them, recommendations on how they can improve in their jobs and so forth. Yeah, well, I would say that they're going to be learning from a variety of faculty members. They have a wealth of experience in the healthcare field. They do a lot of research, and they look forward to working with students to help them kind of attain their goals and learn more about health administration. Dr. Connie Perry, she's done various trips to Costa Rica and other study abroad locations, and students have gone, learned about global healthcare systems, and it's really helped them kind of broaden their understanding of what healthcare is. They can compare our health system with systems all across the world, and they're then able to better kind of serve the patients here by knowing what it looks like.